we've had a lot of people come in today and yesterday with emotional conditions, mainly depression, a little bit of anxiety, and then have you noticed a correlation in pulses the last couple of days?
Yeah.
What have you been feeling in the pulses?
A lot of panicking.
Pretty panicking. So we were picking up liver pulses.
Yeah.
And what were you noticing in the liver pulse when I was talking to you about it?
The liver pulse was getting stronger.
Was it stronger or was it wiry?
Wiry.
It was wiry. And then when the liver pulse was wiry, when I asked you more questions, what were the associated other organs' pulses like? What was the compensation?
Yeah, so the heart was compensating and the spleen.
Yep, and what kind of texture were you noticing in the heart pulses?
Heart pulse was definitely getting stronger.
Yep.
Spleen was just super deficient.
Super deficient.
Yeah.
So when there's a really strong heart pulse, did you notice it on superficial or in the deep?
Superficial.
Just superficial. So
Yeah.
if you push deeper on that heart pulse, would you say there'd be much strength in the heart pulse?
Not as, but still some, but
Yeah.
not as strong.
And then with the previous client before the one that you're thinking of, they had a lot of emotional upsets and hormonal upsets as well. And again, their liver versus spleen pulse, what were you feeling now?
Very similar.
Yeah.
So the liver was still wiry, the spleen was super deficient.
And so normally your brain would go to what type of diagnosis?
Instantly when you feel that wiry liver, you would think liver yang rising
Okay.
or liver stag.
And so in these instances, we were saying it definitely wasn't liver yang rising.
Yeah.
Because in these instances, they're young women between 25 and 32. They're mostly coming for cosmetic and emotional well-being. But we're noticing lots of things in their lifestyle. They still have a lot of anxiety from COVID. They have maybe a little bit of, or a fuckload of stress in their jobs. And when you're looking at them, what colour was their complexion?
More pale.
Pale. What
Yeah.
colour were their tongues?
Pale.
Super
Definitely
pale. Nobody ate a fucking burger in at least a month. There's no red meat on anybody's diet. So when we talked back about why was it not liver yang rising, what other organs were we talking about to make sure for you to understand that we were treating it from a different perspective?
Well, definitely the spleen and the heart and the disconnect between heart and kidney, the spleen being deficient as well.
Yeah.
Yeah.
So when obviously
Kidneys, that just went right over
kidneys,
my head.
yeah.
Kidneys,
So as John Center, we treat a lot kidneys first.
yeah.
Ren my first, Chong my first. Extraordinary meridian is always first because it's your constitutional basis, it's your DNA, it's your gen. We're always manipulating that.
Yeah.
So the reason I don't go straight for liver yang rising is because they don't come in yelling at us, they don't come in already angry. But when they are angry, it's because they've got to the end of their tether. So it's been building. They've been sad, they've been sad, they've been sad, they've been trodden on, they've been trodden on, they've been trodden on. And suddenly when there's no more hormones left, no blood left, what's happened? Whereas if they were liver yang, they would already be.
Always Yeah.
Someone who's liver yang is already prickly. Someone
Yeah.
who's liver yang already doesn't feel safe, and so they are on the offense before they meet you. Those
Yeah.
are the grumpy, angry clients that within 3 sessions melt on your feet. So the reason in clinic we're treating a lot of kidney element rather than necessarily dredging. Why am I teaching you kidney over dredging? What is my theory
Kidney
there?
is more nourishing.
Yeah.
I'm trying to build the deficiency rather than dredge something out.
So explain to me how the kidney is building a liver or building the spleen or building the heart. Are you understanding that process
Yes,
there?
so the kidney is the basis, the kidney is the foundation. If we can get, especially someone that's yang deficient, if we bring back that fire, that yang energy, it's going to help triple
Bring-
effect.
yep,
It's going to build
the-
everything else. You need to get kidneys first for everything else to start.
So that base nourishment,
Yeah.
your vitality nourishment. I also look at it like water. I always think of the kidneys as water. So if the water comes up and then it nourishes the root of that tree, it's not going to be brittle MDF and that liver's not going to be fucking off. And if the water feeds the wood, then it's not going to be invading the earth and the spleen
Yeah.
and the melancholy and the feel sad and the digestion. So then when that liver or the tree is nice and strong and supple with the water, then it's not going to catch fire and give anxiety.
Okay.
Which is why I would never just knock the fire off the top of the heart. So fire and heart element is normally anxiety, can't sleep properly, super jittery all the time, and so that's why we're not going that route in clinic. And also, we don't want to go fucking psycho on the table when we're putting all these pins in their face and they just want to feel pretty.
Yeah.
But everyone is coming to feel pretty,
Yeah.
and we are addressing that.
Yeah.
But none of them are necessarily really aware of the toll that stress has taken on their ability to feel good.
Yeah.
Is what we're working on. So that's today's takeaway in clinic. Good, lovely questions. You'll answer them.
All right.